Welcome back, everyone. I hope you had a chance to talk with some new friends, maybe some old friends over lunch. We've been intentionally trying to give you lots of time to hang out with each other because conferences like this are really important times to hear from people on panels, but they're also really important times just to reconnect with each other, and we want to make lots of space for that. So I'm really excited about this next conversation that we're about to have. But before we do that, I just want to keep a theme going that's been going throughout the day. Rebecca Coakley kicked us off this morning by talking about how important it was to have the right tools in your toolbox, and that sometimes those things are shoes. And so I'm just going to show you the shoe change I've done because you can't wear heels all day on stage. So here we are. But that doesn't mean that the shoes can't be fun when you change into flats. So we're going to segue into this next conversation, which is one I'm really excited about for a lot of reasons. And that's one of those reasons is all the amazing people on the panel. One of the reasons is that this is a very exciting conversation that's going on in Washington right now that actually has a lot of bipartisan agreement, a lot of bipartisan momentum, dare I say, and of all the things that we've been talking about today, all the things we've been talking about yesterday, this is one of those opportunity zones, one of those spaces where there's lots of folks talking about things we might actually be able to do in the relatively near term that would make a huge difference in people's lives. And that's updating some of these outdated rules in SSI by bringing it into the 21st century. So I'm really excited that we have one of my favorite human beings and a member of the Academy's board of directors and a fearless leader at Justice and Aging, Tracey Gronniger, here to moderate this conversation with some amazing people who are part of creating that bipartisan drumbeat around this issue. And so I know you're going to want to hear this next conversation, and Tracey, take it away.
Thank you. I'm really excited to be here today, too. This is like a great group, and I feel like we're going to have a really good conversation. And we sort of got into it a little bit in the previous panel, so I feel like we're kind of continuing the momentum of the discussion. So I have here today my esteemed panel. I'm just going to say your names and where you're from, and then I'm going to start throwing questions to you pretty quickly. But we have Andrew Biggs on screen behind us, who is Senior Fellow at the American Enterprise Institute. Mia Ives-Rublee, who is Senior Director of the Disability Justice Initiative at CAP, the Center for American Progress. Wendell Primus, who is a visiting fellow at the Brookings Institution, and of course, who spent 18 years as Budget and Health Advisor for Speaker Nancy Pelosi. Also Darren Webb, who is CEO of Mindset Care and a founding innovator at the Benefits Futures Studio. And Jen Burdick, who is Supervising Attorney at Community Legal Services of Philadelphia. So thank you all for being here today. I guess I will start, just by saying, SSI was created more than 50 years ago, and we haven't really seen any changes, or not any. We haven't seen changes to some of the core rules to the program. And so we want to talk a little bit, as Rebecca mentioned, about what it means to bring SSI into the 21st century, and what is the real chance that we have for reform that is both bipartisan and really desperately needed. So I think starting with you, Mia, I would love to have you talk about, you speak about your experience as an SSI beneficiary. And I'd love for you to talk about what the program made possible for you, and also what the limitations of the program created in terms of challenges that forced you to navigate difficulties that you might not otherwise have had.
Yeah, thanks. So I'm one of the rare unicorns that is a person that used to receive SSI benefits and am now a policy person and also worked as a provider as well. So I've gotten to see the program in 3 different perspectives. But for me, I started my adult life on SSI. I remember my parents had applied for the program when, as soon as I turned 18. And the thing that they were really concerned about was making sure that I had health insurance coverage. And so the easiest way to do that was to actually go through SSI get me eligible on SSI, say I was supported through that, and then get Medicaid automatically. And so that was an extremely important sort of first step into adulthood, was to be able to have a stable health insurance, because this was before the ACA, and you would get kicked off your health insurance as soon as you turned 18. And then also because of the benefit that would also come with it in terms of the financial benefit. So SSI really provided, and back when I was receiving it, I got about $600 a month, I believe, a little less, and I received it from the time I was 18 until I graduated from my master's program. And so what it provided me was a chance to go and get my education, because I was always told that disabled people had difficulty getting jobs and that I needed to set myself up for success. My vocational counselor told me I should go and get an education. So I got my undergraduate and then I got my master's degree. And it provided me a stable amount of money every month to be able to cover some of my living expenses while I was in school. So, it provided me sort of a basement of sorts to stabilize my life while I was doing that. Unfortunately, when I got on the program, they didn't provide much information about the program. And so I didn't understand any of the rules, any of the asset limits. I didn't know that there was a student exception to earned wages. There were a lot of different things that I just didn't understand, because nobody sat me down and was like, hey, here are the rules. Here are the things that could benefit you in your situation. And that was a very consequential thing, because I got in trouble multiple times while on it and had to pay back some of the benefits that I received, which caused a lot of emotional stress in my life while I was also trying to get an education, which is stressful on its own. So, I was dealing with the asset limit issues, $2,000 in your bank account. That was very, very difficult for me, because my grandma liked to give presents for my birthday and for Christmas, and that could accidentally kick me out of SSI, which would also kick me off of Medicaid. And then also getting jobs as a student. You're encouraged to get an internship, you're encouraged to go get a job during the summer. And that's what I did. And unfortunately, that caused a lot of difficulties where I was having to pay back some of my benefits in order to be right with the program. So, it's a great, amazing program that, is one of the most successful programs in anti-poverty, but it also creates this sort of straitjacket for disabled people in their ability to make choices in their lives that will help and benefit them in the future.
Thanks, Mia. And I think, Andrew, I think I'm going to turn to you, because in a recent op-ed in The Hill, which you co-authored with Jason Figner, you made a really compelling case about SSI reform and why it should be a conservative priority. And you talked about the program's outdated rules and how it pushes people deeper into poverty, and how fixing that is a morally and fiscally sound move. So can you talk us through that argument and talk to us about why you believe that updating SSI's savings and work rules in particular is gaining traction across the aisle?
Well, thanks. And thanks very much for having me and letting me come in remotely. I'm sorry I can't be there with you in person. My policy focus, I'm senior fellow at the American Enterprise Institute. My policy focus is on retirement issues. So I'll really stick to that, because it's the area I know best. But, I'm happy to say that if you use the most accurate data, poverty in old age is down significantly. Compared to 1990, the risk of retiring into poverty today is about a third lower. So that's a really, a great achievement. At the same time, we're a rich country, and addressing old age poverty really isn't very expensive. And updating SSI is the most cost-efficient way to reduce poverty in old age, much more than expanding Social Security would be. The problem, as you said, is the income and the asset thresholds haven't been updated in decades. And that's the thing in the op-ed in the Hill with Jason Fichtner. That's what we talked about. We looked at two bills that are out there to try to address that. The first was the Bipartisan SSI Savings Penalty Elimination Act. That would inflation adjust the asset limit up to $10,000, which is around where it should be if it had been inflation adjusted all the time. That would expand eligibility by around 6%. But almost more important, it would prevent this problem of people getting kicked off the program and having to reapply. So it'd be helpful to both beneficiaries, but also to the Social Security Administration, which has to manage the issue. But going further, we talked about a 2021 proposal from Senators Bernie Sanders and Elizabeth Warren and Sherrod Brown, who, it's not often that I'm endorsing their legislation, but that would go further. It would raise SSI benefits to the poverty line, and right now they're around 25% below that. It would increase the asset limits and also allow beneficiaries to earn up to around $450 per month. And at the time, the Urban Institute projected that would lift 1.2 million seniors out of poverty at an annual cost of $22 billion. For perspective, $22 billion, that's 2% of what Social Security pays out in retirement benefits each year. And all of that money is going to seniors who really need it. We've all seen, the CBO forecasts of rising deficits and debt and, asking, how long this can go on and what we need to do. That doesn't sort of obviate our obligation to provide a strong safety net for people, but it does mean we have to be targeted and efficient in doing it. And so I think updating SSI is really the most cost-efficient way of solving a problem that still affects millions of Americans every year. We can do it in a way that's efficiently and affordable. So I think that's the sort of thing that can get support from both sides of the aisle in what are sort of difficult fiscal times.
Thanks so much. Jen, I'm going to turn to you and ask you about what you see with your clients in terms of how they're trying to navigate sort of all those administrative burdens of SSI, and what are some of the things that we can learn from your experiences and their experiences when we're thinking about SSI in the 21st century?
It's a really good question. And so I kind of think about administrative burdens in this area in different buckets. There's like the small ball ones that I still am very fascinated that exist. Like, for example, that almost all correspondence between Social Security and my clients, whether they have established that they're disabled or after that point, it's all in paper. Many of them are long. They are hard to understand. Someone in the last panel was talking about concurrent recipients. I will say concurrent recipients, if you get SSDI and SSI, you get mail from two different programs. It's not a consolidated letter, and you get it at two different times. So the number of times that I will have a client after we've won be like, you told me I'd get at least $967. They're saying I'm going to get $400. You're like, you got to wait for the other letter. And if there's an issue, sometimes they send those. Even if you've updated your address, one of those pieces of paper goes to an old address. Like, there's a lot of, because Social Security is still paper-based in a lot of ways, that causes a lot of problems. Other things, now SSA is trying to push everything online on My SSA. There's lots of things they should put online. As Chad mentioned, there should be child's SSI applications and survivor's applications. However, all these things online almost are behind complicated verification protocols. Even check today, even if you want to update Social Security with your earnings, so you can let them know that you're not over the income or resource limit, you have to first go onto either ID.me or login.gov in order to access that app, which for a lot of my clients, they cannot do. And who is going to fraudulently report that they are working so that they should reduce their benefits? It's one of those things where I'm like, we need identity verification. I get it, but like not everywhere. And this is one of those things. So there's all these tiny administrative burdens that add up to be a very, very big deal. They make it so people don't apply. They make it so they don't appeal, so that they miss deadlines. But then there's all the bigger things that I think I love that we're talking about today, like the asset limit. Having a $2,000 or $3,000 asset limit, depending on how many people in your household get SSI, is a huge problem. You know, one of my clients, their roof fell caved in, and so they got a loan from a neighbor to pay for their roof. Well, that, you know, SSA monitors bank accounts. They could see that then there was more than $3,000 in the bank account. It took a year to figure that out and to establish that it was actually a loan, that it was an oral loan, but we need to document that it was an oral loan. So anyways, it's one of those things that raising the asset limit would make sense because it's very outdated, but it also would really reduce the amount of stress in people's life as they're trying to monitor these micro transactions which happen. I mean, it's not just your roof, it's also what if you need to replace your car or your dryer or whatever. And some of the outdatedness, it's not just the asset limit or the benefit amount. Particularly in SSI, there's all sorts of other ways we try to limit assets. One that really gets me is in-kind support because it's not intuitive. Most of my clients, kind of like me was saying, like, don't understand that it's not just the money they get that they need to keep track of. And I'll be honest, most of my clients are also not totally in control of what gifts they get. Are you?
No.
But then they get a gift, and then it's a huge problem. And there are all these rules in how they deal with in-kind support and maintenance that are outdated, and as a result, they are unfair and incoherent and hard to follow. One example is if you are living with someone, or you have someone living with you and you're a recipient. There's even an example that Social Security sent out a letter about how their consolidated SSI policies this morning, and they did reorganize the website in a way that's actually pretty helpful. But if you look at the section on living arrangements, in example B, there's a really good example about how outdated policies here make it very hard for recipients to understand what the rules are. And that is, if your child is living with you, and if they give you any rent or help pay your electricity bill, that you need to tell Social Security, because that's the kind of in-kind and support maintenance that they need to use to reduce your benefits. However, since most of these rules were written a long time ago, they even say in the example, if instead your child paid your cell phone bill or paid for your cable, that it doesn't count, right? And what worries me about that is I have clients who it's taken long enough for them to get this benefit. They shouldn't have to be a financial advisor in order to figure it out. And so for people who have the benefit of representation, which is not sufficient or available enough, maybe they will get advice from someone like me to say, oh, your family can help, but they have to pay for your cell phone, or they have to pay for your cable bill, they can't pay for your electric bill, and they can't help pay for your rent. And since most people don't have this, I think even how the rules apply are really, really unfair. Because if you don't get that advice, you're getting reductions that other people aren't in the same circumstance. So this is a very long answer for a lot of different ways that these administrative burdens show up. But a lot of the policy proposals we're talking about today, like raising the asset limit, updating the rules, they really could make a huge impact. And so I'm really excited that there is some bipartisan conversation about it.
Yeah, I would be remiss to not say that we actually are planning for the reintroduction of the SSI Restoration Act. And so that should be happening on March 5th. And we have Representative Adelita Gorhalva and also Representative James Moylan, who is a Republican. So I think I get to say that this is bipartisan now, which is a very new thing to come out of my mouth about the SSI Restoration Act, but it's the time. And we also have Representative Schakowsky and also on the Senate side, Senator Warren. So we have a good group of people who agree that these are some really important program updates that will make important changes for low-income people with disabilities and older adults. So Wendell, I'm going to turn to you because you have been talking a lot lately about Social Security solvency and how that should include SSI. And can you talk about why and how boosting SSI could be a more kind of direct and impactful way to eliminate elder poverty than some of the other options that have been put out, like increasing the special minimum benefit?
Well, thank you, Tracey. And let me begin by saying I agree with what's been said to date. And I really want to compliment Andrew and Jason for putting that op-ed in the Hill, because I do think at the end of the day, it's going to take bipartisan support. And I'll remind this audience, maybe doesn't need reminding, that in 1983, when we did the last major Social Security fix, we did bump SSI. And in the solvency paper, I've gotten 20 former members, 10 Republicans, including 3 Republican former chairs of committees in the House, and 10 Ds to basically say, when you do the Social Security fix, let's also reduce elderly poverty. So I think I want to continue that bipartisan. But the thing I really want to talk about for just a moment, because it's bothered me for a long time, is the interaction between our Social Security program and our SSI program. Today, right now, when you calculate the SSI benefit, you disregard $20 of Social Security benefits. That means there's a lot of people in this country that have paid a lot of payroll taxes but can't get their Social Security benefit above the SSI guarantee. So an important parameter that we're going to have in a paper we're going to release soon is that there should be a disregard of 40% of the Social Security benefit when calculating the SSI benefit. That means those people will then see that they get a return for those taxes they paid. It will also help a lot of people get over out of poverty by disregarding 40% of Social Security benefits when calculating that SSI benefit. So I really think, again, I'm not against raising the benefit level. We also
We
do
can
that.
do it all, right?
But I really think we've got to look at the interaction between our Social Security program and our SSI program. And I really would like this audience to think about that interaction.
Thank you. Darren, I'm going to turn to you now. Only about half of those who are eligible for SSI are actually receiving it, and you have built tech to help fix that. Can you talk a little bit about what's broken in the current application system and what's possible if we actually apply the right tools and innovation to modernize it?
Yeah, sure. We don't have all day to sit here and talk about the issues of what's broken, but definitely starting off where what Jen said around transparency into updates of a claimant. So it's very hard for a claimant to know where they are in the process. It was a big problem when I started Mindset. We assist individuals in applying for disability benefits and acquiring them. 95% of our inbound calls were, what is the status of my application, whether they applied a week ago or 24 months ago. We just started being very proactive in that. We would log into a system called ERE. That's where we see from SSA the update on their application. We download that information. We proactively email and text the claimant before they get the mail 3 weeks later from Social Security about that. That's just a very easy fix that Social Security could do to keep their claimants up to date on their claims. There was just an article in the Government Executive about 2 weeks ago where Social Security moved thousands of employees that were adjudicating claims to answer phones, and 90% of the calls that they are getting are, what is the status of my claim? So it's pretty backwards. It doesn't make too much sense there. So, that's something that's been effective for us, is just being very proactive, allowing them to log into their Mindset profile, which could be their SSA, their My SSA profile, to see the status of their application at all times. Another thing that has been very wasteful for SSA as well as claimants are technical denials at the initial level. Technical denials are you submitted an application, but you're actually, you're over age, you're over 65, you're over the asset allocation, you make too much money monthly, your spouse was gifted a car by his, uncle or father that just passed away, and that puts you both over the asset allocation. We've created a pre-qualification tool that screens for all of these questions, and we don't even submit those applications if they are. I'd imagine Social Security is sifting through millions of applications for individuals that are not even eligible for disability benefits. So, inefficient and wasting time. One thing that I've been very passionate about to try to figure out is the perk call process and attestation, specifically with SSI. And these are two processes that are both 2-minute phone calls at most, that after your SSI application is submitted, the attestation call just verifies that you did submit that application. And then the perk call is post-award. They're calling to make sure that you have a bank account. Do you still have less than $2,000 in your application or in your bank account? And just a few other questions. And a lot of these calls go unanswered. And if they go unanswered over a certain period of time, your application's thrown out. That shouldn't be. There need to be different ways and more innovative ways to deliver this assurance, whether via text message, via email, allow someone to log in, or even a robocall. They don't need to speak to a human to let SSA know that, yes, I have a bank account, yes, I have less than $2,000 still in my account. Another thing, at Mindset, we partner with jails and prisons across America, and something that I hear all the time from the sheriffs there, I don't think their voice has been heard as much in DC and from their representatives. It's a pretty quirky scenario. If two individuals that did the same crime, individual A and B, they shoplifted, and they're both on SSI, individual A that can pay his bail within 30 days and be released, he still has his SSI. Individual B, who cannot afford his bail of $500 and then is stuck in jail for longer than 30 days, his SSI gets paused and turned off. It doesn't make much sense. You're punishing an individual that doesn't have the money to pay for their bail. So that's more of a kind of a policy thing. And if anybody here wants to chat around that and get introduced to some sheriffs, I'm glad to help with that.
Thanks so much. Thinking about policy, Mia, I would ask you if policymakers could hear something, just one thing from someone who's lived it, what is the thing that you would want them to understand about why modernizing SSI is so important?
Yeah, I think what folks don't realize is how long it's been since it has been updated, right? I think, when it was created, the IDEA was not enacted. The Section 504 rules weren't written, and the ADA wasn't signed. So the expectations of disabled people at that time was much different than the expectations of today. So today we have access to much more resources and much more information that allow us to be more involved in the community. So that means that we are more likely to be married or want to be married. We are more likely to have part-time jobs if we're able to do it. We might be doing contract work. All of these different options are out there now for disabled people, but the policy isn't updated for that real lived experience. And so I think it's essential that we look at the program and interview real people who are on the program and start prioritizing and figuring out what are the things that we need to update to make sure that it helps people in the lives that they live right now and not the lives that they lived back when it was signed.
Good point. Wendell, you have been at the heart of major legislative fights, and you know what it takes to make social insurance policy real in Congress. If you had a message for today's policymakers, especially those who are shaping the next Social Security package, about why SSI should be part of this conversation, what would that message be?
I guess I'll go back to something Kathleen said. We've got enormous deficits right now. 1.9 trillion this year, 24 trillion over the next 10 years, according to CBO. And that is political pain. I do not see this administration doing it. And I do think SSI has to be part of the equation at the end of the day, because we ought to, and as rich a country as we have right now, I think the true elderly poverty rate, I'll agree with something Andrew said, is probably about 6% when you take into account the underreporting on the Census Bureau of certain retirement income. I think there is no reason why we can't get that poverty rate below 1%. And I would really like to see Congress, when they tackle Social Security solvency, do that. Let me just say a word, if I may. I see anything that tells me that this administration is going to do political pain and do solvency. Bill Hoagland and I believe the best way, whoever we elect in 2028, is going to have to orchestrate the two parties to go over the cliff together, because it's going to be a lot of political pain to reduce those deficits. And I think the way you do it is to copy George H.W. Bush in the 1990 summit. Most of you may not have been around in 1990 or were in grade school or whatever, but at that time, you had the three money committees, the ranking member and the chairman of Budget, Approps, and Ways and Means and Senate Finance. You had the leadership of both parties, both houses. And so there were about 22 members. Each member got to bring two staff. So Bill and I were there. I was with Dan Rostenkowski and he was with Domenici. And you then have the members own it. They had to keep track with their rank and file to make sure that what they agreed to, they would have the votes when they took it to the House floor. There were some hiccups along the way. But at the end of the day, members have got to write this bill. They've got to own it, and they've got to get the willingness. And I think, again, having Social Security there, knowing that if they don't fix it, how do they go home and explain that you're going to have a 23% across the board cut? Or more likely, I believe what Keith Fontenot tells me, Social Security doesn't have the right to cut a benefit. You would just delay the checks until you have enough current money in the Treasury to pay the check. Believe me, check delays will also cause members to move. So I think that is the way that in 2028, again, that president we elect can see we're not going to make it through the first term without solving this problem. And so that's the way I think we ought to think about getting the political will and getting it done.
Thanks. I mean, I think there is this tension where you sort of see these different approaches to how you do Social Security solvency, and bringing SSI into the picture might actually be part of a broader solution. Andrew, I don't know if you would talk about this, but given your past advocacy for moving to a flat Social Security benefit, do you see an opportunity to strengthen and modernize SSI as a more direct and efficient way to support the people with the greatest needs without necessarily weakening the broader program for everyone else?
Well, yeah, that's a very good question. I mean, I think what you could, if you're somebody like me who thinks, ultimately should move towards a flat Social Security benefit, which is similar to what you have in the UK or Australia or New Zealand, in a sense, people say you want to weaken it for everybody else. And I don't want to take that in a pejorative sense, but the US is unusual in a couple ways. I mean, the safety net for people at the low end in retirement at least is kind of weak, and it's going to get weaker. I mean, the poorest retirees get only a tiny slice of Social Security benefits, and that's projected to decline even further in the future. Similarly, with SSI, eligibility for SSI in old age is projected to decline as well because of the lack of indexing of the income and asset thresholds. So we have this weakness at the bottom, and yet at the top, we are paying dramatically higher benefits than other similar countries do. I mean, the maximum Social Security benefit today for a couple is about $95,000. That's 2 to 3 times higher than what you'd get in other similar countries. So you have to have these things. I mean, I think just realistically, we have to arrest the growth of benefits in the middle of the top end. What makes the SSI element I think helpful is that even though, Wendell's right, poverty and old age is increasingly rare. Seniors, their self-reported financial security is very strong, stronger than younger people. Even though there's not a lot of poverty in old age, Americans are afraid of retiring poor. They really are. You can see it in survey after survey. I think if you can have a package of reforms that says, okay, look, middle and high income people, you're going to have to give up something on the Social Security benefits. You're going to have to save more for retirement on your own, but we can guarantee you are not going to retire into poverty. A really solid guarantee that the federal government can afford. I think if you address some of those fears, people will be willing to make some of the sacrifices that I think are going to be inevitable. So it is really thinking about both things at once. Where is the safety net weak, but also what are the cost drivers of the program? So I think looking at them together, whether it is a flat benefit for Social Security that covers what SSI does, or it is SSI reforms integrated into Social Security reform, I think either of them can do it. But I think we need to think about both angles to understand how people are thinking about what Social Security reform might mean to them.
I think we've had some really interesting discussion about, what the people want and what they've said is important to them. And so thinking about that, we've heard directly from, older adults and people with disabilities through the various polls that talked about the importance of Social Security, and also through, the People Say and Katie Savin's research. And they've told us what things are working and failing in the current system and what they would like. I'm going to ask this for any and all of you, but, how should those lived experiences shape how we prioritize SSI reform? Like, what are the specific messages that we need to carry forward when we're thinking about designing policy that the people actually want?
Well, I guess I will take a stab at this. I think lived experience is really important. A lot of the things I was discussing before are these really granular implementation issues that I think are missed when you're not involving the people who are actually working with the programs. But implementation is a form of policy, and it doesn't matter how well we design this if people can't actually access the benefits we're trying to give them, hopefully more than we are now.
Just to build off of that, I know this is an SSI panel, but the other thing that I find really troubling is, and to get poverty of the elderly down, we're going to have to lower Medicare premiums for low-income elderly. And the participation rate in our Medicare savings programs, quote unquote, is also like 50%. It's like SSI. We ought to lower Medicare premiums, which for someone at 135% of poverty when the major Medicare savings program is almost $3,000 this year. It's $2,900 or about that. That's 13.3% of income at 135% of poverty. That is outrageous for a marketplace employee beneficiary at the same poverty level. They pay zero in ACA premiums. Why we demand $2,800 or $2,900 from a Medicare beneficiary, and that's, look at our Medicare Pro, A, B, C, D, and then if you're in traditional, you have to probably go out and buy a Medigap premium. We have made these programs way too darn complicated.
Just adding on is that, I think when we look at who is making policy right now and who is writing these bills, it is kids, basically, 21 to 25-year-olds who most of them have never been on SSI, never experienced it. And they utilize data and research that is often a best case scenario type of situation. And so what happens is when you're not taking into account personalized stories, et cetera, what happens is that you're building a policy and not the implementation, believing that it's going to be a best case scenario situation. And we have way too many people off to the side, living in different situations, whether they're a different racial category or they're, they don't have an education or they can't read or something else. And particularly within the disability community, you're not going to have a bunch of people who are in the median category of people. And so, unfortunately, what happens is that we get policies that aren't really situated for real lives.
Yeah, Darren, I would actually throw to you, thinking about the real people piece and how people actually come to the program. What do you see when you envision, an actually functional system? Like, what does that look like? How does SSA make that happen? Imagine that for us.
I think the perfect dream scenario is SSA is simply adjudicating cases. They're not information collectors. They're not sifting through too much data. All of that information is collected by their system up front. It's orderly, it's in an orderly fashion, and their job is to simply say awarded or not, and here's the clear reason why for both sides. It's gonna take a while to get there. There's a lot of technical issues, obviously policy, but that's kind of the bright star that I see, and I think there's ways to get there.
Great. And then I'll just throw to each of you kind of a last word of what do you think the priorities should be here? What are the things that you think we need to be thinking about in terms of modernizing SSI? Tell me your last final parting words, I guess.
As a very kind of techno-optimist, SSA needs to move everything to the cloud. They need to move off of mainframes. That will allow information to flow faster, information to be, accessed by third parties, APIs. But if that doesn't happen, we're just kind of crawling until then.
I guess I'll go. I know we've talked quite a bit today, yesterday, about budgets. I see budgets as sort of a moral document. And, we don't ask how much, debt we're in when we're going to war or, settling accounts for ICE or DHS. Why are we doing it for programs that keep people alive? And so that's my thought, is we need to deprioritize the question about the budget and prioritize people's actual lived experiences.
I'll say I want to be optimistic. I think just like in '83, when we get around to Social Security solvency, that bill can also reduce elderly poverty. It can increase the SSI benefit. It can do something on the asset limits, et cetera. And then I also hope it takes a giant step, or a big first step, I'll put it that way, in terms of long-term care and adding that to the Medicare program. So one giant bill whenever we get around, whenever this country, when Congress gets around to resolving Social Security solvency.
I guess I love Mia's point about reframing how we think about the budget. I love your dream bill. And I will add that as they do that, I hope there is a lot of thought and consideration and actually action in figuring out a customer service model that is as coherent and understandable and usable as, high-end luxury brand. Like, there is customer service out there that works for people. Like, that should apply at SSA too, particularly, and consider all the different constituencies that use it, like, in particular.
Well, thank you all. I think we are at time, but this was a really great panel. Thanks to everyone, and hope you all enjoyed listening to this really great group.